Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Hi, everyone. I have Dr. Pankaj Tiwari today and Dr. Rebecca Knackstedt from North Carolina, right? Is that where you are right
Yes.
now? Correct.
Yes.
Okay. Yes.
Duke is in
Yes.
North
North
Carolina.
Carolina. Yes. And we have two amazing plastic and reconstructive surgeons today on the best podcast ever with Dr. Tiwari
The best podcast ever.
and the breast cancer podcast with me. So I'm really excited to have you guys join me today. I know our audience already knows Dr. Tiwari. We've done a number of podcasts together. And today I'm super excited to have Dr. Rebecca Knackstedt. She's MD, PhD. She's a plastic and reconstructive surgeon specializing in breast reconstruction, microsurgery, gender affirming surgery. She's American Board of Plastic Surgery certified, also certified functional medicine practitioner. Your wealth of knowledge, and we welcome you today. Thank you so much for taking the time to join us today. Welcome.
Yeah, thanks so much for having me. I'm looking forward to our conversation.
Yeah, this will be really interesting because we have so many patients where functional medicine concerns come up in the context of their breast cancer treatment
Yes.
and their reconstructive surgery. So there's a ton to talk about here.
There absolutely is.
So if you don't mind kind of telling a little bit about yourself, about your interest in prehab for surgery.
So when I was in residency, anyone who's a surgeon or has done any type of residency, you know that it's all consuming and you're just focusing on learning surgical techniques. And even though I had a background in nutrition and knew that it was probably important for surgical recovery, I really just forgot about it. But then when I was in clinic with my attendings, I saw how many patients were asking, what can I do for surgery? How can I prepare? Is there anything I can do? And there really weren't great evidence-based answers that were given to patients. So they just didn't prepare for surgery. And when I decided to do my certification in functional medicine, which really taught me to look holistically at patients, it was really then that it was cemented for me how important it was to prepare for surgery and to optimize patients not only physically, but also mentally and emotionally before this big event in their lives.
Yeah, I think it's a huge piece, and we never talk about it, to be honest. It's so much about the actual surgical operation and the recovery. It's hard from like a to build a system to really talk about preoperative care and what people can do to maximize their outcomes from a preoperative standpoint. A lot of the problem is you just don't see people with enough lead time to change some
Yeah.
of these habits. You'll see a patient.
Yeah.
You'll refer them to me. We try to get them into surgery in the 4-week time frame. It's
Mhm.
not really enough time to address some of these issues. How do you work that into your day?
That's a very common question that patients ask me. Oftentimes, like you said, if it's a time to treat, we've got to get them to surgery within 4 weeks. And they wonder, is there anything they can do that's meaningful in the next 4 weeks? And when I get that question, I always draw on the head and neck literature, which has really looked at rehabilitation, which has shown that just 5 days of targeted nutrition before surgery can make a huge difference. So
Okay.
while I would love for patients to prepare 3, 6, 9 months before their deep flap, and I think it would make a very meaningful impact on their recovery, just getting patients in the system and giving them that information just 5 days ahead of surgery really can make a difference. So I think that should be encouraging to patients.
That's news to me.
Yeah.
So what does that mean? Like, what does that mean, optimizing your nutrition for 5 days? Like, what does that look like?
The literature that was done in head and neck surgery, now granted, those are somewhat sicker patients than our traditional breast cancer patients. But in those studies, they used some form of immunonutrition, which basically means a combination approach using protein, amino acids like arginine, glutamine, healthy fats like fish oils, sometimes probiotics to decrease infection risk. And just those couple ingredients in this patient population was able to decrease complications, decrease length of time in the hospital, and in some of the sick patients, even decrease mortality after surgery. So those are really big, important outcomes that just nutrition can impact.
Interesting.
Wow, that's really great. So you already alluded to the different types of supplements that you recommend. So is there like a list that you give to your patients?
I do. And I think that this is an idea that's very commonly misconstrued, especially on social media, is the idea of giving someone a supplement to bring their lab values to a normal level. Like if you would go to your primary care doctor, you get your labs drawn and they say, hey, you're low in vitamin D. Maybe you should take some vitamin D to get a normal level. Studies have shown that even if your labs are normal, you still would benefit from extra supplementation, things like protein, vitamin D, zinc, arginine, glutamine, more than your body needs on a day-to-day basis because surgery and its demands of healing is so much more than your body undergoes on a day-to-day basis.
Do you have a specific recommendations on those things that you just talked about, starting with protein?
So when we think about protein, I think that's probably my favorite supplement because it is the most evidence-based to impact outcomes. The RDA for protein, which is recommended to general population, is about 0.8 grams per kilogram of ideal weight, whereas studies and surgeries have shown that that number increases almost to 2 grams per
Yeah.
kilogram. And if you ever sit down and track your macros, that is a lot of protein. That is hard to get unless you're eating very strategically or taking a supplement. So I do recommend that my patients take anywhere from 20 to 40 grams of a high quality supplement of protein per day before surgery.
So do you have them, for example, a collagen powder, or what are you having them do?
I typically recommend a complete protein so that it's ensuring all the amino acids are well represented. For my patients that choose to consume animal products, I like whey protein if it's tolerated. Egg white protein is a really good option too. For patients who choose not to eat animal products, complete sources of protein are hemp, pea, and soy. So if you are eating an incomplete protein source like beans, you
Mm,
just need to even eat more protein than that 2 grams per kilogram to make sure that you're meeting all your amino acid needs.
Okay.
interesting. And you find patients they're able to do this in a consistent way before surgery? What kind of
What
what kind of obstacles, as we kind of roll this out for our folks, what obstacles are we gonna have to deal with?
we were just talking a little bit before the podcast that what I have found in my practice is that patients either jump headfirst into the idea of preparing for surgery. They want to do something. And for other patients, just the idea of having surgery is enough. That's all they
Mm,
can really emotionally
yeah.
handle. And that's okay. We'll meet them where they are. But I really find like a 50-50 split. Patients either go for it or they don't. I think that the biggest obstacle is financial. It is expensive, as we know, especially today, to eat healthy, prioritize high quality protein, take supplements that's several dollars a day. So that is very challenging. And it's something, unfortunately, that's not covered by insurance.
Mm.
So it's patients paying out of pocket in a time that is already so financially demanding.
That's really a great point. Recently I've had a lot of patients come in and wanting to do alternative medicine. So they don't want to do the traditional, recommended therapies. There is this notion out there that, we are recommending all this chemo, radiation, surgery, and endocrine therapy to make money. That's actually exactly what the patient said to me, a couple of weeks ago. And, my response to that was that, the what we recommend to you are evidence-based, whether it's surgery or chemo or radiation. It's nothing that I would not recommend for myself or my family. And so how do you handle, I'm sure you have patients come into asking you about how would you incorporate the alternative medicine into the traditional medicine that we recommend for patients?
Absolutely, especially for breast cancer patients or really any cancer patients. This is such a vulnerable time. They've been giving this life-altering diagnosis. A lot of times they're young, they have young kids, they have a thriving career. They want to do whatever they can do to optimize their successes. And they go into social media and they see these people who are selling supplements and telling them that mammograms cause cancer and that chemotherapy leads to your ultimate demise. And they're confused and overwhelmed. They don't know how to trust. So that is one of the very big negatives of social media. And then patients come into clinic, like you said, and they want to discuss, you have the idea of conventional medicine, which is traditionally what we're recommending. And then you have these alternative things, which might be acupuncture, yoga, vitamins. And I think that really the best thing would be when they're complementary. Some things from the alternative sphere can be very successfully implemented in addition to the conventional medicine. As an example, high dose vitamin C IV infusions has been shown that if it's given during chemotherapy for breast cancer, it can decrease fatigue and nausea. So that really is complementing each other, giving you that cancer fighting benefits of the chemotherapy, but offsetting some of the side effects with that alternative approach.
And you recommend like acupuncture, massage, and things like that as patients are going through the traditional treatments?
Many of the interventions that I recommend, a lot of those alternative approaches, I always talk to patients about the risk benefit. There's not a whole lot of risk for things like yoga, guided meditation, deep breathing, even acupuncture, but the benefit is potentially there.
Right.
It's hard to do really well done studies on a lot of those topics, but if it works for the patient, if doing acupuncture decreases their fatigue, makes them feel better, and allows them to eat healthier and exercise, it is worth it for that person. Once again, a lot of those are expensive and not covered by insurance.
Do you, at Duke, do you have a team to kind of help direct patients into these different treatments, or is this all kind of coming from you and then you give them options and let them explore on their own?
We unfortunately do not. At Duke, we have a nurse navigator who meets with patients at their diagnosis and pretty much shows them what we have to offer that would be covered by insurance. Things like counseling and therapy, a meeting with a dietitian, sex therapy, talking about freezing eggs if that's something you're interested in. But we don't have a functional medicine department. We have an integrative medicine department, but it's a very expensive and the wait list is too long for these patients who really need to get optimized quickly. So a lot of it is just the conversations I have with them, the handouts that I give to them talking about some of these topics, and then directing them to my social media page to help them learn more about what they can do on their own time.
Yeah, I think that's the hard part is really kind of um, guiding them to the right practitioners. And, we certainly have people in Columbus and Ohio that we direct them to, but I don't know if we have a formalized way to do that. So I think that's a really nice thing to start thinking about.
Yeah, so we do have in Columbus, Ohio, nurse navigators who meet with them. We have social workers. It's fine, like you said, we meet patients at the worst time of their life. And these patients already have other things going on in their life, whether they're going through a divorce or they just lost a job or they're struggling with some financial concerns or a child who's sick now. In addition to that, now they get told that they have cancer. And our goal is really to treat the whole person. Yeah, I mean, I can take out the tumor. That's not a big deal. It's easy for me to do. That's what I do. But I want to be able to help them and somehow get them back to that new normal. They never go back to their old normal. I say, it's life is so different now. It's richer if you make it, if you give it meaning, it can be richer. But to helping them to get to that new normal, it is tough. It takes a lot of different steps and there's multiple layers. That healing is never linear. It's, can be somewhat challenging depending on where patients are in their life. I guess the question to you is, I have 4 to 6 weeks. I mean, you have about 4 to 6 weeks from the time we meet the patient. And how can we optimize these patients to surgery? Is there any lab work that you recommend, other than the routine CMP and CBC that we get for them?
Unfortunately, there really aren't good labs that allow us to know how nutritionally sound a person is.
Mm,
We have things like albumin, which is a good marker of protein stores, but it's imperfect. We have things like you just mentioned, like CBCs, CMPs, but we really don't know yet how best to determine the nutritional status of someone. There's a lot of fancy tests we can do, like fancy CT scans where we measure people's muscle mass, but apart from that, there aren't. And I think that you guys would probably say the same thing, but you almost develop a spidey sense after a while. You see some patients walk in, especially if they're undergoing neoadjuvant chemo, and we start the discussion about reconstruction. And I tell them, there's not a lab value that is making me say this, but it just seems overall the frailty right now of where you are is maybe not the best option to proceed with reconstruction at this time. And for a lot of those patients, those are the ones that go on to get infections and needing
Correct.
multiple surgeries to deal with complications. But that really is a missing piece of medicine is how best to determine who's going to develop those complications, who's going to have a rougher recovery, and then how do we make it better?
Yeah.
yeah,
I
you're so right. It really is sort of like you get an impression or it's your instinct as to this person, there's just something about them that they're not going to progress well post chemotherapy. That's real common.
Mhm.
But I do the same thing where I'm just kind of, you get an overall picture of the patient and you're like, I don't know if we should move forward here because I'm worried about how things are going to go.
Absolutely. And it's so hard because that's not what they want to hear.
Yeah.
They want to have their mastectomy and their reconstruction in the same day. And I think to your point, the most dramatic changes are when we do have the opportunity to meet them before chemo to just start the discussions. And then we'll regroup somewhere half between, like in the middle of chemotherapy, and the drastic changes that have occurred just in the way they carry themselves, their overall energy, fatigue, the weight changes, the metabolic changes. It's tremendous. They are a different person than when you met them 4 to 6 weeks before that.
Yeah. I have a question for both of you,
Hmm.
since both of you are microsurgeons. I posted on my social media platform today saying that we are, doing this podcast, and I asked listeners for any questions. One of the questions that was asked was, how could someone help themselves to recover from an implant-based reconstruction as opposed to autologous reconstruction? What or would be your tips? I'm gonna, go with you, Dr. Knackstedt, first, as to what would be your recommendation for that patient who just had a mastectomy with implant-based reconstruction, as well as someone who's had autologous reconstruction, meaning using their own body tissue.
Yeah, they're very different surgeries with very, very different pros and cons and recoveries. I think the main difference, because I'm going to give the same nutrition recommendations, stress and sleep management, stress and anxiety management, sleep optimization. For me, the main difference is what I'm going to recommend from a muscle optimization before surgery. And I never thought about this until I had my own patients and they gave me this feedback. But when you think about a patient who's undergoing implant-based reconstruction, whether it's the same day as the mastectomy or a different day, the area of her body that we're doing surgery on is her breasts. And then we typically have some type of weight lifting restrictions for a couple weeks after surgery. So her arms are somewhat limited. But for a person who undergoes a body-based reconstruction, especially if we're using the lower abdomen, we've just taken out her core for 2 to 3 months. So when that woman is thinking about how is she going to get up out of bed on post-op day 2, she needs to use her legs. So what I tell my patients if they're getting ready for a body-based surgery is do everything you can do to increase your leg strength. Do squats, do aerobic activity, because you are going to need that so much more than the woman who's just having the implant-based reconstruction.
Yeah, that's a great point. We always kind
Yeah.
of, worry about folks with lower back pain that can be made worse after
hmm
flap, something body based. I really kind of focus on, I always tell them, this is a good time to do all the things that your mother told you to do, you know, eat healthy, lean proteins, good fats, get plenty of sleep, get plenty of sunshine. I think those things really do matter, in the preparation for any type of surgery. I do think that we have a little bit more opportunity to address some of the healing concerns under a deep flap, just because it's a much bigger surgery, it's a much bigger operation, there's more healing to do. Whereas the autologous or the prosthetic-based reconstruction, the incisions are more limited, and there are other variables there, mastectomy, lymph node dissection, all those pieces that are outside of the patient's control.
Who knew your mom was right all along with the
Right.
recommendations, right?
Yes, yeah. So this is really great conversation. Is there any myths or misconceptions patients have about breast reconstruction that either of you would like to clear up?
There's a lot.
Yeah.
I think that, once again, the double-edged sword of social media. Social media can be wonderful for people to develop social networks and see
Mhm.
very honest, unfiltered before and after photos and just develop a community around themselves of women who went through the same exact thing that I personally can't relate to. And it's wonderful for them to have that community. But there's so much misconceptions out there about implants and about the difference between autologous reconstruction and fat grafting. And I think that a lot of it is perpetuated on these forums or Reddit by well-meaning patients that just didn't really understand what was presented to them. And then it just gets passed along from patient to patient. So I just always encourage people online to look to who you're getting your recommendations from. And most of those questions should be addressed to your healthcare team, especially ones related to things like wound healing issues and infection. Don't ask Facebook if you should go to the emergency room. That is definitely something you should ask your surgeon.
Yeah, I think one that I see a lot is things have changed tremendously over the past decade, 2, 3 decades. And a lot of patients will come in saying, my mother went through this, and I saw her go through, problems with a pedicle tram flap or problems with an implant reconstruction. And I think a lot of that is addressing sort of the trauma and stress of that experience that they went through alongside a family member, and also recognizing that things are very different now. The way we do D-flap reconstruction
Yeah.
is very different than 20 years ago. The way we do implant reconstruction, tremendously different than 20 years ago. So I think patients, of course, would assume there have been changes, but it's hard to like really kind of internalize how much things have changed.
Yeah.
Absolutely.
The couple of myths that I want to clear up. One is patients think when they have a biopsy, if all of a sudden you're exposing the cancer cells to the air and it gets spread everywhere, and that's absolutely a myth. I diagnose about 250 cancers a year, so if that was the case, everyone would be having cancer everywhere. So that's definitely a myth. And the second one I hear, it's sort of my pet peeve, is when patients have breast cancer, they're getting implant, base reconstruction. They think it's like augmentation and not really
Mm-hmm.
reconstruction. And nothing can be further from the truth. I mean, when you're having augmentation, and you both know this more than I do, is you're putting an implant where there's already breast tissue there. But when a breast surgeon does a mastectomy and doing reconstruction, it's so different because you're removing the breast tissue 90 to 95% and then doing the reconstruction. So how one looks after that type of surgery is very different than how one looks with breast augmentation.
Yeah.
Absolutely. I've seen a lot of posts on social media, interestingly, lately, where they say a mastectomy is an amputation. And that's such an important point because it really is. And
Yeah.
I think that for a lot of patients, they're really upset when other healthcare providers or just their friends and family say things like, "How was your boob job?"
Mm.
Having breast
Yeah.
cancer and reconstruction is not a breast job, and a deep flap is not a tummy tuck. They're very, very different. And I think that words like that can be really upsetting to some breast cancer survivors.
Yeah, I 100% agree. Thank you for saying that.
Yeah.
That's actually my pet peeve. That was actually said to me when I had my own surgery, and I was really upset. But thank you for saying that.
I have a question for Becky.
Yeah.
What are some, maybe the top 3 recommendations you can give us that are like really high impact to get our patients better optimized for surgery?
Top three. I would say that I liken preparing for surgery like preparing for a marathon, in that you can show up for your marathon and run 26 miles, but it is not going to be fun. And similar for surgery, you can show up the day of surgery and we're going to get you through it. We're going to do the surgery that you're trained to do, but it could have been better from a recovery standpoint. So I do encourage patients to think about it that way.
Mm.
I would say we've talked a lot about nutrition, and I think that protein intake and increasing your lean muscle mass before surgery is probably the most important thing that you can do from a nutrition standpoint.
I
The
definitely,
third, sorry, say that again.
I definitely agree with that.
Mhm. And it's something that we often, as surgeons, don't enforce enough to patients. The third I would say is sleep optimization.
Mm.
Mm.
When a woman or anyone has a diagnosis of breast cancer, they're already going into this chemotherapy and surgery with anxiety, which causes poor sleep and stress and potentially pain and discomfort. And sleep has shown to impact everything from how much pain you feel, whether or not you respond to chemotherapy. It's even shown to impact mortality after a breast cancer diagnosis. So talking to patients about what can they do to optimize their sleep before surgery so that when it's made worse after surgery, they already have those tools in their toolbox to know what they can rely on to get a good night's sleep.
Yeah, I like that.
Yeah, those are really great recommendations. I agree. I do talk to patients about protein intake and lifting, weightlifting. There is so much research that's now coming
Mhm.
out with weightlifting for women in general, not only improving that lean mass is important, not only to keep your, your body weight within normal limits, but also helps with releasing BDNF, which helps with your brain function, maybe decreases the chance of dementia in the future, being able to protect yourself from falls. And, I have so many patients that come in and they're diagnosed with cancer, but they're like, just last week, I diagnosed someone who is, being a walker. They do, her and her husband go with friends on these hiking trips, and she's in her 70s, and she's like, I am so active, I eat so healthy, why did I get this? And I don't know the answer to that. What I do know is, because she was taking care of herself, because she was hiking and walking and taking good care of herself, what I know is her recovery is going to be so much better than someone who was not doing that, so much better than someone who is a smoker, someone who's obese, someone who's diabetic, not controlling their blood sugars. And I think that's why I think this conversation is really important in how to get optimized for surgery. Yes, we only have 4 to 6 weeks, but there's so many things I think our patients can do: exercising, mindfulness, meditation, sleeping, exposure to sunlight, and, using those people in your immediate circle to help you as you're going through this, an illness that is, once you recover from it, you're going to have your best life, but you need to go through that process.
Absolutely. That made me think of another pet peeve, speaking about that healthy patient. There's so much on social media now about 100% of cancers being preventable. And
Yes.
the people who are propagating that are selling a class, a supplement, some type of very expensive intervention. First off, that's not true. I think we can all agree on that. Studies show that about 40% of cancers are preventable. But what that does is, just like your 70-year-old, I have so many patients who come into clinic and say, I'm 30 years old, I eat healthy, I exercise every day, I have a spiritual practice. Why me? What did I do wrong? And then that leads to feelings of guilt and anxiety and regret, which is so unhelpful at this already anxiety, stress produced experience that they're in. So I think we need to stop propagating that myth as well.
And I like thinking of it as a glass half full. We can't control who gets breast
Right.
cancer, but you're 100% right. People that have really put the time, effort, energy into taking care of themselves,
Yeah.
they will have a more successful outcome and easier recovery. I think the data is very clear on that. And we all see it
Yeah.
in our practices. When someone's going to have trouble and when they're not. And it has a lot to do with their habits, what they've been doing. And there's no shame, no judgment. Everyone's different. But I think that these are important principles that if you can optimize, one or two things in your life, your sleep, your nutrition, it's going to make a difference for your recovery.
Yeah.
What long-term lifestyle practices support optimal outcomes after reconstruction? Question to both of you.
That's a good question. One of the things that I love about being a plastic surgeon is that we follow patients, especially if they're implant based, for the rest of their lives. So you get these women through this terrible experience in their initial reconstruction, but then you see how they thrive and get back to their baseline, or don't, after that experience. I would say the thing that plagues these women the most is the fear of recurrence. even if they're 5, 10, 20 years out, they're always afraid of the recurrence. And when we get an ultrasound to check their implant integrity, they're worried that that ultrasound is going to find something. So I would say from a long-term success standpoint, it's maintaining all of those healthy interventions like we just talked about, but it's finding some way to deal with that stress and anxiety, whether it's mindfulness or a spiritual practice or whatever works for the patient. That is going to be very, very important for the rest of their lives.
That's such great advice. And I know you alluded to supplements earlier. Is there any supplements you recommend? I know your PhD in vitamin D, but
I love supplements. I take a lot of supplements. I would say that I love vitamin D and K2. I think that especially if you are working inside and not getting sunlight, so you're probably not getting enough vitamin D. I think that probiotics are very, very evidence-based to have a multitude of important effects. I would be careful of a lot of other supplements though, because it seems like there's a new exciting supplement that's supposed to cure some disease coming on the market every other week. And they're expensive. A lot of them aren't evidence-based, but they're typically being promoted by the person who's selling them. So once again, just be careful where you're getting your information from.
Yeah, I like this. What supplements do you take?
Oh, so I do take vitamin D, calcium, magnesium glycinate. That's really about it. I don't take anything else. What is your thoughts on omega-3 fatty acids?
Oh, I love omega-3s. Yes, I love omega-3s. They're anti-inflammatory. They can be heart protective. I actually do recommend them before surgery. There was initially fear that omega-3s would increase bleeding risk before and after surgery, which is why most patients are told to stop them. But there was a meta-analysis that came out several years ago that showed that omega-3s, even up to 9 grams a day, did not increase bleeding risk. So I do have my patients continue before and after surgery. One other supplement that I really, really love, both for myself and for my patients, is creatine. The evidence for creatine just keeps building for muscle mass and decreasing risk of sarcopenia, but also now even for cognition at higher doses. So it's kind of gross to take, but I do take creatine each day
So we
too.
have some real commonality. I take vitamin D, I take magnesium, and I take creatine. Those are the three supplements that I take.
I actually just started doing creatinine like a couple of months ago. I use the powder and drink it in water. I actually have noticed such a difference in my energy levels. I know it has all these benefits, but my energy is so much higher even after working 12, 14 hours a day. The day I don't take it, I do notice a difference. So I do think there is something to that for sure.
That's so interesting.
Sarcopenia is a real thing and it affects us in our 30s, right? Like, I mean, it really happens very quickly. So I'm glad that you talked about omega-3 helping heart protective. We talk about cancer. This is breast cancer podcast, best podcast ever. But really the most common disease women die of is heart disease, right? So the things that you recommend, I love all the things you guys are both recommending today because those things not only help you from decreasing the risk of cancer coming back, the sleep, the exercise, the nutrition, the supplements, the sunlight, but also it decreases your risk of dying from a heart disease. And I think that's really important that we cannot forget, and we need to keep emphasizing for those women who get diagnosed with cancer, it's not the most common cause of death, it's the heart disease. And we have to remember that and not forget that.
Especially for some of the chemotherapeutic drugs, which can have a cardiotoxic effect. Yeah, it's very important to protect the heart.
Yeah. There's something I heard you say about BMI. I actually really liked what you said. What are your thoughts on BMI? Because we always tell patients, your BMI so and so. What are your thoughts on that?
It's an interesting discussion to have with patients because weight and food can be so triggering for some individuals, and it's a sensitive topic. When we think about food, it's not just a source of nutrition, it's spending time with family and friends and holidays and memories. And it's hard to tell someone that they need to change their lifestyle as it relates to food intake. The challenge with BMI is most people in the healthcare world now agree that BMI is an imperfect indicator of someone's overall health. And that's very true. You can have BMI of over 30 and still be very fit, eat well, lift a lot of weights, and just be very strong and have a lot of muscle mass, which can weigh a lot. I do have a BMI cutoff for surgery though, and mine is somewhere around 35 to 38. And the reason for that, even though it's an imperfect measure, is that there are very well done studies in the breast reconstruction world showing that a BMI of over 35 has an increased risk of complications. Once again, these are population studies, so it's lumping together all of those patients who had a BMI of over 35, whether they're healthy or not. But I still do recommend that patients decrease their BMI to below 35 if possible to just statistically decrease their risk of having a complication.
Yeah, we use a BMI of 40 as our absolute cutoff. 38 to 40 is like a relative cutoff, but I do agree that not all BMIs are the same. A 35 BMI in one person can be very different than somebody else.
Absolutely. And it's if you talk about deep reconstruction, especially where a woman carries her weight, a BMI of 35, over 35 could lead to not great aesthetic outcomes if she carries her weight differently. So I talk to patients about that too, where even if I think it's safe to do the surgery, if she's willing to lose weight, it might be better aesthetic outcomes if she can lose a little bit of weight.
What do you think about the GLP-1s? That's such a,
Yeah.
incredible change to how people are dealing with obesity now. And it's been I think, dramatic impact in our practices, for good and for bad. There's certainly limitations to it, but what's your experience been with it?
Prior to those medications coming on board, when I had patients who would come to me and their BMI was too high and I would recommend weight loss lifestyle interventions, I never had a patient who came back with a successful weight loss. And it's just so multifactorial. There's so many things that go into losing weight. So when the GLP-1 medications came on board, I did have a lot of patients whose BMI was 38 plus and were able to drop it down to 35. So I love that these medications are giving patients who were not reconstructive candidates the ability to have reconstruction safely. What I have noticed though is that for these individuals, if they weren't told to increase their protein intake or focus on resistance training, their albumin plummets because you lose so much muscle mass when you lose that amount of weight. So I had a woman recently where her BMI was 38. She went on a GLP-1 medication. Her BMI went down to 30 and her albumin went from 4 and change to 3, which is, in my opinion, not safe enough to do a big surgery like a deep flap. So when I tell patients that, if I know they're going to talk to their PCP about going on those medications, I have the discussion about make sure you eat a lot of protein, make sure you focus on resistance training, and we will measure your albumin before we schedule this really, really big surgery.
Yeah, I think it's a super important point because I
Yeah.
think one of the main concerns with GLP-1s is bone loss and
Yeah.
muscle loss. And it certainly does happen, but it can be mitigated by protein intake and strength training. So a point that I think gets lost with a lot of the GLP-1s.
Mhm. Yes.
Yeah. So to summarize everything, there is a way to optimize our patients for surgery, even though we have 4 to 6 weeks. And both of you have had such great points in optimizing nutrition, exercising, meditation, sleep, sunlight, supplements, and just taking care of your whole person as you go through this process. Is there anything you'd like to add that I did not ask you to our conversation to optimize patients going to surgery?
I think that's a great list. And I just want to make sure that patients don't feel overwhelmed. Sometimes I think they hear that list and it's just too much to do.
Yeah.
So I really just want women, really anyone having surgery, just to feel empowered that even if you change one or two of those things,
Yes.
even in a small way, you're going to have an improved experience after surgery.
Yeah, that is very true. You can make a ton of changes all at one time, but even if you're working out 10 minutes a day or 10 minutes twice a day, that's 20 minutes, or 3 times a day, that's 30 minutes. So I think it does, make a huge impact. Anything else you would like to add,
No,
Dr.
I like
Deepa?
that. I think baby
Yeah,
steps are still steps,
yeah,
and it's okay to take small steps, make small changes.
yeah,
They will improve your outcomes.
yeah.
And I think we all have to just encourage patients to do that.
I will say, as a cancer survivor, your control is taken away from you. But things we can do that are in our control is this huge list we just talked about, and I think that allows you to take your power back. And I think it's a great list. I'm asking every guest on my podcast about what's your routine that you practice for exercising to keep yourself healthy. Like, what's your routine, Dr. Knackstedt?
I have a 2-year-old and a 4-year-old, so it is not the ideal routine. But what I try to do is, like we talked about, people become sarcopenic in their 30s. So my my exercise routine has changed a lot. High school, college, it was cardio, and that's what we were taught to do.
Right.
And now it's really changed to be predominantly resistance training, lifting heavy things, which is so counterintuitive if you've been
Right.
trained just to be on the treadmill your whole life. But that is really what I try to do. And then eat lots of protein and use some of the supplements like we talked about, like creatine.
That's wonderful. How about you, Dr. Tiwari?
Oh, I mean, I've always liked to lift, so I do like to lift, and I'll try to lift at least 4 times a week. Um, I do a lot of sort of mobility and flexibility things I do my box, I do jujitsu, so those are things that really keep you moving. It's also good for Parkinson's because those types of random pattern movements as you're reacting is good for your cognition. So, but a lot of it's just when you have time, rather than doom scrolling on my phone, I'll go and go for a walk or maybe try to do some pull-ups. So
Yeah.
a lot of it's just, again, baby steps are still steps, and that's how I approach exercise.
Yeah. So Dr. Tiwari and I did a morning routine podcast a few months ago. That was probably the most well-heard listen to podcast. People ask questions about that. But I am also very similar. I also do a lot of strength training. I've always liked strength training. I do cardio a couple of times a week. I need to do more than that, but I just don't have time. But I do strength training about 4 times a week, do creatinine, lots of fluids. And on the weekends, I do have this where I get up early in the morning when the sunlight is coming up. I like to go for walks, but we live in Ohio, so that hasn't been happening a lot. But yesterday I did 5 miles, and that's when I get my ideas for the podcast for, different, if I'm going through, I have an issue in my life, if somehow I find answers. So I do like a run, walk, or sometimes I run, sometimes I walk. So
I think walking is a very underrated exercise.
I think so too.
It
Yeah.
really is.
Yeah.
For people that can't just get up and run 3 miles, I think walking is a great way.
Yeah. I think for women, that's what they recommend. I mean, strength training and walking. If you can get those two things in, they say it's great. Sleep, I try to sleep, but, just with training, I train myself to sleep 4 or 5 hours in residency fellowship. That's still something, hard for me to get used to, but try to get about 6 hours of sleep. But I'm working on it to 7 hours. So one of these days.
What's your morning routine, since people liked our morning routines?
Yes. So as surgeons, we have to be at the hospital pretty early. So I usually get up around 5:15 and try to get in a half-hour workout, which is honestly the most I can do most days. So I also do like to do resistance training. If I'm doing cardio, I use a weighted vest, which I found has been really just engages your core and back more. And then I do a lot of things like yoga too, because as we know, especially doing microsurgery, long cases, it hurts your neck. So you need to keep that mobility and flexibility. I used to do intermittent fasting, but I found that it was just too hard on surgery days. So I try to eat a high protein breakfast, which is usually a protein bar. But apart from that, just trying to optimize sleep as much as I can. And like you said, instead of getting on Instagram, get around, even walk around the house and get moving. It's better than doomsday scrolling.
Yes, I agree. Yeah. Well, Dr. Knackstedt, this has been such a great conversation. You're wonderful. Your patients are so lucky to have you at Duke. And thank you so much for taking the time today to join us, and lots of great pearls and tips on how we can optimize before going to surgery. So thank you to you too, Dr.
Yeah, really
Tiwari.
great conversation.
Yeah, thank you so much for having me. It was really fun.
Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer, this podcast is not intended for complete medical advice, so please talk to your medical professionals.